Do you look into, like, I know a lot of concerns, especially with people as they're approaching that age, is healthcare and Medicare.
Healthcare is a big thing with me.
So
healthcare is a huge
okay.
component of me. Healthcare, basically, and I may get pushback, but there have been studies done. And healthcare, you have to, like college planning, when I'm doing college planning, 5%.
Mm-hmm.
So if I'm looking at you and saying, Becca, when do you want to send little Mary, little Becca, and where do you want to send her to college? Oh, Sean, I want to send her to University of Penn.
Mm-hmm.
Okay, well, this is what the cost for University of Penn is now, and little Becca has 15 years. So this is
how do we get there?
This is what you're going to have to set aside, and I take that number, and then with the inflation factor of 5%,
it's like $2 million.
5% a year. Okay?
Yeah.
So then after you fall off the chair and I help you back up again, we figure out a way to do this.
Mm-hmm.
Okay, so then we have to figure on, okay, we're probably going to have to rely on some grants and, maybe some student loans, but, whatever planning we can do, like 529s or cash value life insurance.
Medicare and Medicaid.
Medicare, you can do the same thing if you plan ahead.
Okay.
Medicare is more of a 5.7% inflation.
Okay. So that would mean that whatever it costs you today, healthcare, you can expect
$500 for a person to pay for healthcare today, 20 years down the road, it's going to cost you about $1,500 and change a month.
Okay.
A month.
So how do you plan? So you start 20 years down the road and figure out how much money you're going to spend.
You have to pick the right plan. And the thing is here's where my concern lies, is men predecease their wives. So what happens is, in the course of him dying, or passing into the next world, what's happening is they're in a spend down mode because they haven't done planning. Mm-hmm. So what happens is there's very little in the way of savings for the surviving spouse or partner.
Right.
Okay. That to me is a big problem. And that is a problem that I want to fix up front and address that up front in the planning process. Mm-hmm. That's why I get a little bit concerned when they're hung up on what their return on is with Fidelity or Schwab. It's irrelevant when you retire because you're spending. Mm-hmm. Okay, so what you want to do is you want to maximize the things, so that you don't have that big of a gap between your Social Security and your pension. Right. If all you have is Social Security and you have your retirement savings, this is where the next part of the plan comes in, because then we look at, okay, when do you want to retire? You don't show up on somebody's doorstep when you're 65 and say, hey, I retired yesterday.
Yeah.
That's something that you should start 5 or 10 years realistically and look at healthcare, look at mortgages, debt, reducing debt, an actual, what I call that retirement frontier over the next 30 years. It's irrelevant whether you're going to live 30 years or 35 years or 40 years. We're living longer.
Right.
So
let's plan for it.
Exactly. So we have
that's fine.
That 4% rule is not really a viable option. I mean, people still argue that point, but it's realistically more like 2.8, 2.7 withdrawal rate.
Got it.
Okay. So if you have $1 million, realistically, the rule of thumb is you could take 2.7% out and probably not outlive your money if you want to, just utilize your investments and, tell the advisor to go away, okay, and not do any planning. That's fine.
If you have that giant nest egg
to
start with.
It may or may not work, but even $1 million is flawed. I mean, I've had clients come to me with $1.3 million, okay, from my workshop, and he was 62 and he wanted to retire. Mm-hmm. We said, okay, fine, let's do the analysis. We did the analysis and everything else, and he was going to blow through over a third of his retirement nest egg between 62 and 66.
Wow.
It's not a good plan.
Yeah.
It's not a good plan.
And if he hadn't met with you beforehand, he probably would have done it just thinking.
He would have done it because the advisor that he was working at the wirehouses, okay, was saying, yeah, you can. Mm-hmm. And our response was, you can on paper, but let's look at it. Let's look at it.
Maybe a little more.
So what we did is we did the Social Security analysis. We looked at some small pension income, and basically what we ended up doing is when I sat down with him, I said, would you consider working part-time?
And what do you say?
He went to part-time.
Oh, good.
Okay.
That's better than blowing
And his
through it.
plan is working. Okay. I haven't had one of my clients, and I can proudly say that, really get hit or affected in the 2008 crash because we planned.
Fantastic.
Okay. I mean, there were some losses, but not big losses. Nothing that they couldn't have